May 12, 1945, Bad Reichenhall, Bavaria. The folder slammed onto the makeshift desk with such force that water splashed from Dr. Elizabeth Mueller's tin cup, staining patient records that would have meant precious hours of work lost. Impossible. The Americans are setting a trap. We can't accept their supplies. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow I've saved something extra special for you. Through the cracked windows of the converted schoolhouse hospital, Elizabeth could see the Bavarian Alps where countless German refugees had fled in the final months of the war. Now, as chief medical officer of this overcrowded facility, she held in her trembling hands a report that challenged not just Nazi propaganda, but the entire moral foundation of what she'd been taught about American soldiers. According to intercepted communications and reports from colleagues still operating in Munich, the American 116th Evacuation Hospital Unit was preparing to deliver 3 truckloads of medical supplies to German civilian hospitals. Penicillin, plasma, surgical instruments, anesthetics, critical supplies that German doctors hadn't seen in reliable quantities for years. Captain Rebecca Hoffman, standing at attention before Elizabeth's desk, had triple-checked the intelligence. The information remained the same. What neither woman knew was that this moment would trigger the most transformative humanitarian operation in modern warfare, the systematic dismantling of German civilian mistrust of American intentions, healing a broken nation through medicine and compassion, reshaping German-American relations for decades to come. The collapse of German civilian trust had begun 4 years earlier. In 1941, propaganda minister Joseph Goebbels had presented German citizens with frightening tales of American barbarism, stating that American soldiers were instructed to show no mercy to German women and children. Ordinary Germans had believed these stories, literally believed them, declaring Americans would only bring starvation and disease, not healing and rebuilding. "The Americans are monsters," Goebbels had told German civilians in his radio broadcasts throughout 1941, months before Pearl Harbor. "Their democracy makes them cruel. Their diverse population makes them savage. Their capitalism makes them heartless. They cannot possibly offer aid without ulterior motives." By May 1945, German medical networks across Bavaria were reporting something that defied every assumption of Nazi racial theory and wartime propaganda. The reports came from different sources: Bavarian doctors working in field hospitals, Catholic nuns operating orphanages, Protestant deacons managing refugee centers, even intercepted letters from German civilians to relatives in neutral countries. They all said the same impossible thing. American medical units were distributing penicillin to German civilians, saving children with infections that would have been death sentences just weeks earlier. German doctors were being trained in new surgical techniques developed during the American campaign in the Pacific. Women and children were receiving food rations equal to those given to American support personnel. Oberstleutnant Margareta Weber, head of the hospital's intelligence section, had spent 3 weeks analyzing the data. A former University of Heidelberg medical professor who had lived in Boston for 10 years before the war, Weber understood American medical capacity better than most German doctors. Her residency at Massachusetts General Hospital during the 1930s had exposed her to American pharmaceutical production capabilities. She had watched Americans pioneer mass production of biologics and vaccines in less than a decade. "Dr. Mueller," Weber reported solemnly, "if these reports are correct, and I believe they are, then everything we were told about American intentions was a lie. They're not here to exterminate us, but to save us." The intelligence came through circuitous routes, each more surprising than the last. Helga Schmidt, running the hospital's primary network of refugee informants in Berchtesgaden, had cultivated sources among German civilians who traveled freely between rural hamlets and American-occupied towns.
These people spoke candidly of miracles they witnessed, unaware their dinner conversations were being transcribed by hospital staff desperate for information. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. On May 3, 1945, local schoolteacher Friedrich Bauer had visited the converted town hall in Bad Reichenhall, where Elizabeth maintained a clinic for children. After several cups of watery ersatz coffee, Bauer began describing his recent encounter with American medics, arranged when his daughter developed a potentially fatal streptococcal infection.
Dr. Mueller, Bauer had said, unaware that Johanna Keller, a nurse taking notes on seemingly routine patient information, was recording every word. What I witnessed defies description. The American field hospital is cleaner than our hospitals were even before the bombing began. The medical supplies are stacked floor to ceiling. They have antibiotics, real antibiotics, not the diluted versions we've been struggling with for years. Bauer had pulled out a small vial and began explaining its significance. They call it penicillin. My daughter was dying, Dr. Mueller. The infection had spread so far, I could see the red lines moving up her arm toward her heart. The American doctor, a Captain Williams, injected this miracle drug, and within hours, not days, the infection began to recede. My child, who couldn't lift her head in the morning, was sitting up asking for food by nightfall. Johanna had asked, trying to sound professionally interested, but surely such sophisticated medicine means they're only treating select cases, experimenting perhaps. Bauer had shaken his head vigorously. That's what we feared, but they've set up a triage system that treats the most critical first, regardless of nationality. There was an American soldier with a minor wound waiting while my German daughter received life-saving medication. When I asked the nurse why, she simply said, "Children come first, always." Perhaps the most detailed intelligence came through Lutheran church networks. Pastor Thomas Weiss, who maintained communication lines with parishes throughout Bavaria, provided detailed accounts of American medical aid distribution while secretly sharing this information with Elizabeth's hospital in hopes of establishing similar programs. In early May 1945, Weiss attended a coordination meeting at a church in Berchtesgaden, where he met Major Sarah Rosenberg, an American Jewish doctor whose family had fled Germany in 1936. Rosenberg, believing she was speaking to a representative of civilian welfare interests, spoke candidly about the medical operations scope and intentions. "Pastor," Rosenberg had said, unaware that every word would be in Elizabeth's hospital within 2 days. "When I first visited the refugee camps outside Munich in April, they were experiencing a typhus outbreak that threatened to become an epidemic. Children were dying at a rate of 20 per day at one camp alone. I knew we had to intervene immediately." Weiss had pressed for details, claiming professional interest as a community leader concerned for his flock. Rosenberg, passionate about her mission, obliged. "I spent one night in my tent sketching out the entire medical distribution plan. We would treat the most vulnerable first, children, pregnant women, the elderly, not by having patients seek us out, but by bringing medicine directly to them. Each mobile unit visits 3 to 5 locations daily, establishing regular routes so people know when to expect us." The pastor had asked about the logistical challenges of such an ambitious humanitarian mission. "We repurposed our supply chain. The same trucks that brought ammunition to the front now bring penicillin to orphanages. The same pilots who flew bombing missions now airlift medical supplies. The same radio networks that coordinate attacks now coordinate vaccination campaigns. Democracy means utilizing resources for peace as effectively as for war." Through Swiss Red Cross, Swedish diplomatic, and Vatican channels, German hospital administrators received consistent reports confirming the American medical aid distribution. Swiss doctor Lucas Hoffmann visited several American medical installations in May 1945 and reported, "The operation functions with efficiency that defies European understanding. They use standardized medical kits, consistent treatment protocols, and centralized supply management. Their record-keeping is immaculate, tracking every dose of medication from depot to patient." German medical administrator Clara Fischer's coded message to colleagues in Nuremberg, intercepted by Elizabeth's informants, provided independent verification. This single American medical battalion distributes more penicillin monthly than the entire German medical system had access to during the final year of the war. By mid-May 1945, Elizabeth's staff had assembled comprehensive data from 23 independent sources, confirming the scale and scope of American medical assistance. The numbers were staggering. 300 mobile medical units operating throughout Bavaria and Baden-Württemberg, over 50,000 German children vaccinated against diphtheria and pertussis in the first month of occupation. Infant mortality in American-occupied zones decreased by 64% within weeks. Desperate for direct evidence, Elizabeth authorized Operation Mercy, sending her most trusted nurse, Maria Schneider, to investigate American medical operations firsthand. Maria, who spoke flawless English thanks to years studying at Johns Hopkins University before the war, was instructed to bring her genuinely ill son to an American medical station, observe their procedures, and report back with unvarnished truth. In the early morning hours of May 15, 1945, Maria and 8-year-old Karl waited in line outside a former Luftwaffe administrative building in Berchtesgaden, now repurposed as an American medical clinic. Karl's chronic asthma had worsened in recent days. His breathing labored and lips slightly blue. No pretense necessary for this mission. Within 20 minutes, an American medical technician triaged them, placing Karl in the urgent category ahead of dozens of others, including several American military personnel with non-critical issues. Maria, trained to observe, noted this triage system violated everything Nazi propaganda had claimed about American priorities. "My son can hardly breathe," Maria explained to the American nurse, a young woman named Lieutenant Emily Coleman. "He has asthma, and it's getting worse. We've been using herbs and steam, but—" She left the sentence unfinished, expecting dismissal or minimal care for a German child. Coleman surprised her by immediately calling for a doctor. "We'll get him breathing better right away," she said, leading them to a treatment room equipped with medications Maria hadn't seen in German hospitals since 1942. "Dr. Rodriguez will be right with you. He specializes in respiratory cases." The doctor who entered was a dark-skinned Hispanic man in his 30s, another shock to Maria, who'd been told America's diverse population meant inferior medical care. Dr. Rodriguez examined Karl thoroughly, listening to his chest with a stethoscope that wasn't cracked or repaired with tape, using a pen light that worked on the first try. "Your son has significant bronchospasm," he explained, speaking slowly so Maria could understand his accented English. "We're going to give him an injection of epinephrine for immediate relief, then start him on aminophylline. We also have a new medication called diphenhydramine that's showing promise for allergic components of asthma." Within minutes, Karl received his injection. Within an hour, his breathing eased considerably. Dr. Rodriguez spent 30 minutes educating Maria about asthma management, providing her with 3 medications to take home. Medications she recognized as items German hospitals had reserved exclusively for high-ranking Nazi officials in their families during the war. "Come back in 3 days so we can check his progress," Rodriguez instructed, handing her a small mechanical device. "This is a peak flow meter. Have Karl blow into it each morning and evening and record the numbers in this booklet. It will help us track his lung function objectively." As they prepared to leave, Maria gathered her courage and asked the question that was central to her mission. "Why are you helping us? We were your enemies." Rodriguez's answer would become legendary among the German medical community. "I don't treat enemies or allies, ma'am. I treat human beings. Your son is a child who couldn't breathe. Now he can. That's the only victory that matters to me." By the time Maria returned to Elizabeth's hospital that evening, Karl was breathing normally for the first time in months, playing with other children in the hospital courtyard. Maria's report was comprehensive and emotional. "They treated my son better than our own military hospitals would have treated an officer's child at the height of the Reich's power. Their medications work, their procedures are advanced, their compassion appears genuine. Everything we were told about American medical intentions was a lie." On May 20, 1945, Elizabeth received intelligence showing American medical aid projections for the coming year. 5 million doses of penicillin allocated for German civilian use, 2 million children to be vaccinated against common childhood diseases,
20,000 German nurses to be trained in modern medical techniques, 10,000 German doctors to receive updated education in American medical advances developed during the war. Elizabeth's response when presented with these figures? The Americans claim they will provide more medical aid to German civilians in 1945 than the Reich provided in all of the war. It's either the most elaborate deception in history or the most profound moral rebuke of everything we were told. By June 1945, Elizabeth was working directly with American medical authorities, her hospital integrated into the broader humanitarian response. Her initial skepticism had been replaced by cautious
Collaboration, then active partnership, as the evidence of American intentions became irrefutable. The turning point came on June 13, 1945, when a typhus outbreak threatened the refugee camp outside Bad Reichenhall. Within hours, American medical teams arrived with vaccines, DDT for delousing, and mobile shower units. Elizabeth worked alongside American doctors for 72 hours straight, witnessing their dedication firsthand. American Army nurse Captain Rebecca Johnson told Elizabeth during a rare break, "I've been awake for nearly 3 days straight treating German patients. Does that sound like someone who came here to punish your people?" Elizabeth could only shake her head. "We were told you would bring disease, not prevent it. We were told you viewed us all as Nazis." Johnson had laughed, a tired sound in the pre-dawn light. "Dr. Mueller, I don't have time or energy to hate. I've got too many patients who need me. American, German, Polish, Russian, it doesn't matter. Disease doesn't check your political party before it strikes. Neither does my medicine before it heals." By August 1945, German civilian hospitals were reporting unprecedented recovery rates. Surgical survival rates increased from 37% to 86% with American antibiotics and techniques. Childhood infectious disease mortality rates dropped by 71%. Maternal deaths during childbirth decreased by 64%. German public health official Werner Schmidt sent a confidential memo that found its way to Elizabeth's desk. "We must acknowledge an uncomfortable truth. More German children will survive the first year of American occupation than would have survived under continued Nazi rule with its collapsing medical system. This is not propaganda, but statistical reality." The children told the story most eloquently. 8-year-old Greta Hoffmann had developed osteomyelitis in April 1945. Under German wartime medical protocols, amputation would have been the only option, if she could even get surgical attention at all. American doctors administered penicillin intravenously 4 times daily for 3 weeks, saving both her life and her leg. "The American doctors showed me pictures of his own daughter," Greta told Elizabeth during a follow-up examination. "She's 8 like me. He said he was treating me exactly as he would want someone to treat her if she was sick in a strange country. Is that true, Dr. Mueller? Do Americans really think that way?" Elizabeth, who had lost her own daughter to a simple infection in 1943 when penicillin was unavailable in German hospitals, could only nod, her professional composure momentarily cracking. "Yes, Greta, I believe they do, and we must learn to think that way too." The medical bridge became a cultural one. German nurses training alongside American counterparts exchanged not just clinical knowledge, but recipes, photographs, stories of home. German doctors attending American medical seminars found themselves in scholarly debates rather than interrogations. The healing of bodies facilitated the healing of perspectives. American Chief Medical Officer Colonel James Harrison, addressing a conference of German doctors in July 1945, articulated the philosophy that had so confused German civilians. "We fight wars against governments, not people. We defeated Nazism, not the German nation. Our quarrel was with Hitler, not with German children who need medicine. To withhold treatment would transform us into the very evil we fought to destroy." By September 1945, Elizabeth Mueller's hospital in Bad Reichenhall had transformed completely. The hallways, once dim with despair, now buzzed with purposeful energy as German and American medical personnel worked side by side.
The supply cabinets, barren just months earlier, now contained organized rows of medications, bandages, and instruments, many with labels in both German and English. What began as suspicious acceptance of American aid had evolved into a collaborative medical partnership that would redefine post-war European healthcare. Never in my medical career did I imagine working alongside Americans, Elizabeth confided to her journal on September 10, 1945. Yet today I performed 3 surgeries with Dr. Catherine Bennett from Chicago. She showed me techniques developed at the Mayo Clinic that reduced our operating time by half. The patients will recover faster with less pain. How do I reconcile this reality with everything we were told about American intentions? The transformation extended beyond hospital walls. Throughout Bavaria, American medical initiatives had created visible changes in civilian health and morale. Children who had been listless and underweight now played energetically in town squares. Mothers who had given birth in fear now attended American-established prenatal clinics. Elderly Germans who had expected to die from untreated conditions received care from mobile medical units that visited even the most remote villages.
Colonel Margaret Williams, director of the American 116th Evacuation Hospital, provided Elizabeth with unprecedented access to their supply chain management systems. "We're not just giving you fish," Williams explained, using an analogy that transcended language barriers. "We're teaching you to fish." Germany must rebuild its medical infrastructure, not depend indefinitely on American aid. The statistics compiled by Elizabeth's staff revealed the scale of the operation. American medical personnel had conducted 132,000 civilian consultations in Bavaria alone between May and September 1945. They had performed 27,340 surgeries, delivered 8,721 babies, and administered 387,000 vaccinations. These numbers, impossible to dismiss as propaganda, forced even the most skeptical German medical professionals to acknowledge the reality of American humanitarian commitment. Dr. Heinrich Wagner, who had served as a medical officer on the Eastern Front before being reassigned to Bad Reichenhall, struggled particularly with this cognitive dissonance. "I watched our troops execute Russian doctors who tried to treat German wounded," he confessed during a staff meeting in late September. "We were taught that showing mercy to the enemy was weakness. Now I observe Americans treating our civilians before their own soldiers in some cases. Their moral framework operates on principles entirely foreign to what we were taught." The most dramatic evidence came from comparative mortality rates. In regions under American medical supervision, infant mortality had dropped to 3.2% by September, lower than pre-war German rates and approaching American civilian standards. In areas still without regular American medical support, infant mortality remained above 22%. The difference could not be attributed to anything but the effectiveness of American interventions. Public health measures proved equally transformative. American engineers had restored water purification systems in 42 Bavarian communities by early autumn, virtually eliminating waterborne illnesses that had ravaged refugee populations during the chaotic final months of the war. Typhus, which had threatened to become epidemic in May, had been reduced to isolated cases by September through systematic DDT application and vaccination campaigns. Captain Rebecca Hoffman, initially skeptical of American intentions, now coordinated vaccine distribution between Elizabeth's hospital and American supply depots. "The Germans at Dachau conducted medical experiments on prisoners," she noted during a planning meeting. "The Americans conduct medical education for German doctors. The contrast could not be more stark or more damning to what we were led to believe." October brought new challenges as autumn chilled the Bavarian mountains. Respiratory infections threatened vulnerable populations, particularly the elderly and children living in damaged buildings with inadequate heating. American medical planners had anticipated this seasonal shift and positioned supplies accordingly. Major Sarah Rosenberg arrived at Elizabeth's hospital on October 3rd with 3 trucks loaded with winter medical supplies. "We've brought specialized pediatric antibiotics, influenza vaccines, and cold weather medical kits," she explained as German hospital staff watched in amazement. Each kit contains thermal blankets, pediatric and adult-sized masks, vitamins, fever reducers, and educational materials on preventing hypothermia and recognizing pneumonia symptoms. The distribution system reflected American industrial efficiency, adapted to humanitarian purposes. Each village received supplies proportional to its population, with additional allocations based on vulnerability assessments. Record-keeping was meticulous, with every vial of penicillin tracked from American production facilities to individual German patients. This systematic approach contradicted everything German civilians had been told about American disorganization and waste. They operate their medical aid with the precision we once reserved for our military, observed Dr. Weber after reviewing the distribution protocols. The difference is that they organize to save lives rather than take them. By mid-October, American medical authorities had established training programs for German medical personnel in 17 locations across Bavaria. These programs transferred knowledge alongside physical supplies, ensuring sustainable improvement in German healthcare capacity. Elizabeth attended a 3-day surgical workshop in Munich,
where American surgeons demonstrated techniques developed during the Pacific Campaign. The Americans have compressed a decade of medical advancement into the war years, Elizabeth reported to her staff upon returning. Their trauma protocols, developed on battlefields from North Africa to Okinawa, can be adapted perfectly to our civilian hospitals operating with limited resources. They've discovered ways to conserve blood, reduce infection risk, and minimize tissue damage that make our pre-war techniques appear primitive by comparison. The workshop had included practical training on new medications. American pharmacists explained dosing protocols for penicillin and sulfonamides, treatment algorithms for common infections, and medication management systems that reduced waste. This knowledge transfer proved as valuable as the medications themselves, multiplying the impact of physical supplies through improved utilization. Perhaps most surprisingly, American medical personnel shared innovations developed specifically for the Pacific Theater that proved invaluable for German civilian applications. Portable water purification systems designed for jungle warfare worked perfectly in bomb-damaged German cities with compromised water infrastructure. Nutritional supplements created for malnourished, liberated prisoners helped German children recover from years of inadequate diet. Battlefield blood transfusion techniques saved countless German lives in understaffed rural clinics. The Americans have repurposed their entire war machine for healing, Elizabeth wrote in her October report to the emerging German Civilian Health Authority. Jeeps that once carried soldiers now transport doctors. Aircraft that delivered paratroopers now deliver antibiotics. Radio networks that coordinated bombing runs now coordinate vaccination campaigns. The speed of this transformation defies comprehension, yet the evidence surrounds us daily. November brought the first snow to the Bavarian Alps, and with it came new evidence of American commitment. When mountain passes threatened to isolate remote villages, American medical teams switched to airdrops of supplies. When fuel shortages imperiled hospital heating systems, American engineers installed portable generators. When an unexpected diphtheria outbreak struck a children's home near Berchtesgaden, American medical units established a field hospital within 4 hours of notification. This responsiveness particularly impressed German medical administrators accustomed to bureaucratic delays. During the war, requesting emergency medical supplies might take weeks with uncertain results. Under American administration, emergency requests received same-day responses, often with more supplies than requested, along with offers of personnel support. German nurse Maria Schneider, whose son Karl continued to thrive on American-provided asthma medications, maintained detailed records of these rapid responses. On November 12th, we notified American medical authorities of 3 cases of meningitis in the Schönau refugee camp at 0740 hours, her log recorded. By 0925, an American diagnostic team had arrived. By 1100, they had confirmed bacterial meningitis and begun treatment. By 1300, they had established prophylactic treatment for all exposed individuals. By 1700, they had screened the entire camp population of 842 persons. No further cases developed. Under our previous system, dozens would have died before bureaucratic approval for intervention was granted. This operational tempo astonished German medical professionals, revealing a flexibility and responsiveness they had been told was impossible in democratic systems. Nazi propaganda had insisted that American diversity and democratic processes would create fatal inefficiencies in crisis response. The evidence proving otherwise accumulated daily. Dr. Rodriguez, who had treated Maria's son months earlier, returned to Bad Reichenhall in November to establish a respiratory specialty clinic. Working alongside Elizabeth and 3 German pulmonologists, he implemented treatment protocols for chronic conditions exacerbated by cold weather, poor nutrition, and inadequate housing. We're seeing asthma cases respond to combined therapy approaches that weren't available in Germany during the war, Rodriguez explained during a case review session. The medications themselves aren't magical. It's the systematic application, patient education, and follow-up monitoring that creates transformative outcomes. These are approaches any medical system can implement with the right training and resources. The educational component proved particularly valuable. American medical units distributed illustrated pamphlets in German explaining basic
Preventive health measures, symptom recognition, and when to seek medical attention. These materials, developed by American public health experts and translated by German-American medical staff, reached populations with limited access to direct care. A German mother in the remote village of Marz-Schellenberg later told American evaluators, "The picture book showing how to recognize pneumonia in children saved my daughter's life. I knew from the illustrations that her rapid breathing and blue lips meant I couldn't wait for the doctor's weekly visit. I took her to the American medical station in Berchtesgaden immediately. They said another day's delay might have been fatal." By December, American medical authorities had established a revolutionary program that particularly impressed Elizabeth: preventive health screenings for German children. Rather than waiting for illness to develop, American doctors examined children in schools and orphanages, identifying nutritional deficiencies, dental issues, and developing conditions before they became acute emergencies. This approach fundamentally reorients medical practice, Elizabeth observed after watching American pediatricians screen 213 children in a single day at Bad Reichenhall's primary school. "We've always practiced reactive medicine, treating illness after it appears. The Americans practice preventative medicine, addressing health problems before symptoms develop. The efficiency of this approach in terms of resources, suffering prevented, and lives saved is mathematically undeniable." The statistical evidence supported her assessment. By December, regions with American-implemented preventive screening programs reported 43% fewer emergency pediatric hospitalizations than regions without such programs. The cost-benefit analysis was equally compelling. Each preventive screening cost approximately 1/17 the resources required for an average hospital admission. Christmas 1945 brought the most poignant demonstration of American medical commitment. Elizabeth had expected medical operations to slow during the holiday, assuming American personnel would prioritize their own celebrations. Instead, the opposite occurred. American medical units organized special clinics on Christmas Eve and Christmas Day, bringing not just medical care, but small gifts, extra food rations, and holiday activities to German children in hospitals and orphanages. At Elizabeth's hospital, American nurses decorated the children's ward with paper snowflakes and pine branches. American doctors dressed as St. Nicholas distributed antibiotics alongside small toys crafted by American soldiers in their off-duty hours. American cooks prepared traditional German Christmas treats using ingredients unavailable to German civilians. 8-year-old Greta Hoffmann, now fully recovered from the osteomyelitis that would have cost her leg under German wartime medical protocols, received a handmade wooden doll from an American sergeant whose own daughter had sent it from Chicago specifically for this purpose. "The American children sent us presents," Greta whispered to Elizabeth, her concept of enemy permanently altered. "Their fathers were fighting our fathers, but they sent us dolls." Captain Emily Coleman, the American nurse who had first treated Maria Schneider's son back in May, explained the philosophy behind this approach. "Healing bodies is only half our mission," she told Elizabeth as they watched German and American children singing Christmas carols together in the hospital courtyard. "We must also heal the psychological wounds of war, particularly in children. A child who receives medical care alongside kindness today will remember that kindness when building tomorrow's world. This isn't sentimentality, it's strategic peace-building through medical practice." The new year brought formal recognition of what had developed organically over 8 months. In January 1946,
American medical authorities established the German Civilian Medical Rehabilitation Program, institutionalizing successful practices and creating permanent training systems for German medical personnel. The program's founding document, co-authored by American Colonel Williams and Elizabeth herself, stated principles that would guide German medical reconstruction. Medical care is a human right, transcending national boundaries. Knowledge freely shared multiplies in impact. Prevention before treatment. Children's health as the highest priority. Sustainable systems rather than temporary solutions. Cultural respect alongside clinical excellence. These principles, revolutionary in post-war Europe, would later influence the formation of international medical organizations and public health approaches worldwide. The program, initiated in Bavarian hospitals by pragmatic American medical officers, would eventually inform global health initiatives decades later. Elizabeth, addressing her staff on January 15, 1946, articulated the transformation she had witnessed.
Believed American medical aid was a trap, propaganda, or at best, temporary charity that would vanish once strategic objectives were met. Today, I acknowledge a truth that contradicts everything we were taught. The Americans came as conquerors, but remained as healers. They had every justification for vengeance, but chose mercy instead. Their example challenges us to rebuild not just our medical system, but our entire concept of how nations should behave toward even their defeated enemies. German pediatrician Thomas Fischer, who had worked alongside American doctors since June, added perspective gained from treating over 2,000 children. Under Nazi racial theories, many American doctors would have been considered inferior, whether Jewish, Hispanic, Black, or from immigrant backgrounds. Yet these supposedly inferior doctors saved countless pure German children using medical knowledge developed in America's diverse, democratic society. The evidence of which system produced superior outcomes surrounds us in every recovering child. By February 1946, Elizabeth's hospital had been fully integrated into the new German civilian healthcare system, with American advisors transitioning to background support roles. The medical supplies, once delivered by American military trucks, now arrived through German civilian distribution channels established with American guidance. The knowledge transfer had created sustainable capacity. Dr. Catherine Bennett, preparing to return to her Chicago practice after 9 months in Bavaria, left Elizabeth with patient outcome data that told the program's story more eloquently than words could. In May 1945, a German child with bacterial pneumonia in this region had a 31% survival probability, the report documented. By January 1946, that same child had a 94% survival probability. The difference represents thousands of lives saved, not through miracle cures, but through systematic application of medical knowledge, preventative practices, and resource allocation according to need rather than privilege. Elizabeth kept this report in her desk drawer, referring to it whenever doubt or bureaucratic obstacles threatened the new medical systems being established. The numbers provided irrefutable evidence that transcended politics, ideology, and national boundaries. Evidence of what was possible when medicine prioritized healing above all else. The final assessment came from an unexpected source. In March 1946, Swiss medical observers conducted an independent evaluation of healthcare transformation in American-occupied Germany. Their conclusion: the American Medical Rehabilitation Program in Bavaria represents the most successful humanitarian intervention in modern European history, measured by lives saved, suffering prevented, and sustainable capacity created. The speed and scale of implementation defied conventional assumptions about post-conflict medical reconstruction. For Elizabeth Mueller, the journey from skepticism to partnership had transformed not just her medical practice, but her understanding of human potential. The American doctor who had treated Greta Hoffmann's osteomyelitis left her with words that became her guiding philosophy. Medicine at its best transcends the artificial boundaries humans create between themselves. The bacteria don't care about nationality, religion, or politics. Neither should the antibiotics. This principle, once understood, changes everything. By spring 1946, the children told the story most eloquently. In playgrounds across Bavaria, children who would have died under wartime medical conditions played alongside American soldiers' children, sharing games and snacks, creating the foundation for a peace more durable than any treaty could establish. These children, saved by American medicine but growing up as Germans, would become the generation that rebuilt not just Germany's physical infrastructure, but its place in the community of nations. Elizabeth, watching children play in the hospital garden now blooming with spring flowers, reflected on the mathematical certainty that had replaced ideological deception. More German children were alive because of American medical intervention than any propaganda could ever deny. This truth, proven in thousands of individual cases under her direct observation, had forced her to question everything she had previously accepted about American intentions, human nature, and the possibilities for reconciliation after devastating conflict. The legacy continued long after American medical units transitioned to civilian administration. Thousands of German medical professionals trained under American protocols went on to rebuild German healthcare, incorporating lessons learned during this extraordinary period. Preventative screening
Programs pioneered in Bavarian villages became standard practice throughout Germany. Medical education reforms initiated by American advisors transformed German medical schools. Most significantly, the children who experienced this medical transformation firsthand grew up with fundamentally different perspectives than previous generations. A child saved by American penicillin could not easily accept narratives of inevitable conflict between nations. A mother whose baby survived because of American vaccines developed lasting skepticism toward dehumanizing propaganda. A doctor trained in American medical techniques carried that knowledge forward, saving countless future lives. The true measure of this program won't be visible for decades, Elizabeth wrote in her final report in April 1946. Its success will be measured in children who grow to adulthood, in medical advances built upon shared knowledge, in institutional practices that outlive individual careers, and most importantly, in transformed perceptions about what is possible when healing takes precedence over hatred. The American medical intervention in post-war Germany demonstrated an essential truth that transcended that specific historical moment. Humanitarian action speaks more convincingly than any propaganda. German civilians, who had been told for years that Americans were monsters, witnessed instead systematic compassion delivered with industrial efficiency. No theoretical argument could counter the lived experience of a child restored to health by the very people depicted as enemies. This lesson, written in the recovered health of thousands of German children, created the foundation for what would become the most stable peace in European history. The healing of bodies facilitated the healing of nations, one patient at a time, establishing trust where only suspicion had existed before. The legacy continues in modern medical humanitarian interventions worldwide, in medical education systems that emphasize knowledge sharing across borders, and in public health approaches that prioritize prevention alongside treatment. The principles established in those critical months, when American medics treated German civilians with the same care they provided their own soldiers, continue to influence how nations approach post-conflict reconstruction and healthcare development globally. Up next, you've got two more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from us.